Health, Ethics, and Law, an international educational initiative of the World Association for Medical Law.
We're very excited and happy to have Dr. Tom Noguchi and Dr. Oren Asman here to speak to us today about ethics in forensic medicine. Dr. Noguchi is a longtime forensic pathologist. He worked for the LA County Coroner's Office, and he was the chief medical examiner for a number of years. He's also currently the president of the World Association for Medical Law. And Dr. Asman works a lot in many areas of bioethics, particularly mental disability law. They've been working on this collaborative interdisciplinary project, so one trained in medicine and one trained in law, to try to look at ethical issues in forensic medicine and to bring some expertise and some guidance in that area in terms of ethics. Dr. Asman is the executive vice president of the World Association for Medical Law, so they are both working independently at their institutions and then through this larger world international organization. So I'm looking forward to this presentation, and there'll be time for question and answers afterward. So thank you both for being here.
When you talk about forensic pathology ethics or professional ethics in general, we are trying to set professional bar or standards, something that people could work by, ethical standards, like what should be the guiding rules, maybe not exactly what you have to do, but what is the direction that you need to go. And we're trying to mark the commitment of the people who work in this profession to the society, because they're not just working for themselves, they're working for the society as part of the society. This goes to lawyers, this goes to doctors, this goes to forensic doctors, of course. And we try maybe to have this compass, like a professional compass. It's not going to tell you exactly what to do, but give you directions where you should generally strive to go to, right? And maybe it will also keep the status of the profession more clean, so people don't talk about forensic doctors as people who are eager for blood and organs, because I've met some of them, and that's not the impression I have, okay? Very hardworking, dedicated people, but maybe thinking and talking about ethics need to be a very important part of the training and the work. And also keeping the profession free of wrongdoers, at least people who are not intentionally doing, criminal things. And that's, I think, what ethics is really about. Many of the people don't really intend of being, ethically wrong. So I guess the first question to ask, that's what I do in courses of ethics, doesn't matter in which school and to which profession. What does it mean for me to be a forensic pathologist? And for that, I'm lucky to be able to work with Professor Noguchi, who may be a symbol of forensic doctors around the world. And I think we're starting to make sense of this big thing that is called professional ethics in forensic medicine. Some points that we discussed. What would be the circumstances that warrant an autopsy? To begin with, what would justify doing an autopsy? We don't have an autopsy in any case. So what should be the minimal requirement to decide about that? This is a legal question, this is a professional question, but it also has ethical basis to it. I guess the question is, do we want to have an autopsy on everybody? Well, it can't be done. Do we inform relatives about the possibility of having an autopsy? Hey, why not? Well, if you have parents who just had their newborn dead, maybe they're not really interested in having people kind of doing an autopsy on him. But then again, 2 years later, they may just, and it's the case that happened, they may complain, why didn't you tell us that we can have an autopsy? That could help the research about sudden infant death syndrome. We could have had some sort of closure by knowing that the death of our child was not in vain, had it been a part of the research about understanding the reasons for sudden death of infants, right? So there are considerations to each direction. How about informing relatives post facto? In some cases, maybe you don't find them, you don't have time. Not to mention the question, who are the relatives that are relevant? Let's say a guy is married, so should it be his wife? And what happens if he lives with his lover and he's going to divorce this wife, but they're formally still married? Who would be the person who chooses? These are not theoretical questions. We actually face those questions on a daily basis. How about preserving organs? For how many years do you keep those organs? Criminal cases in Israel sometimes takes many years. So do you keep them until a certain phase? Do you just keep records of what it was? Do you keep just a small portion? Now, why does it matter? Well, to start with, some religious people think that as long as parts of the body are not buried, the soul cannot rest, cannot go into wherever it is that it goes. Now, you can accept that or not, but some people believe in it, and it's important for them. How do we balance our scientific need, our legal need to have the best possible evidence, on the one hand, and respect for others, for the next of kin, or for the religious beliefs of the person who died? Burial and disposing of organs and tissues. Do you bury the tissues without informing the family or with informing the family? Do you bury it in the same grave with the person or in a mass grave? Now, it may sound horrible, but these are actually things that make people upset, worried, and complain and feel that they were hurt. So we have to think about those things. How about sharing the results of the autopsy with the public? So you had Michael Jackson, we had Ofra Khaza, a very well-known singer. Was it really necessary for us to know that she had AIDS? Well, it was interesting, but is it really something that the public need to know? Was it important for us to see the autopsy results of Yitzhak Rabin, Prime Minister who was murdered? I guess so. But this is a bioethical question that is also relevant to the forensic medicine field. How about allowing the presence of a family representative during the autopsy? Well, court said, yes, it's possible, but it has to be a doctor. We can't have just anyone in the room. How about research that is based on the specimens or on the autopsies themselves? What about using the cadavers for training? We had a case of a father who was a doctor, and when he just said goodbye to his son who committed suicide as an army soldier, he found that he had the cut here that was stitched, and he immediately understood what it was. They were training how to perform a saving life procedure. Why not practice it on real people? Well, maybe you need to get informed consent before. Well, the person is dead. Okay, these are the kind of questions that we need also in the legal setting. So, to sum up, we are looking for a way to analyze those things from an ethical perspective. We will use different methods. The one that I like most would be actually looking at a personal ethical decision-making model and to try to implement it on different cases with real forensic doctors so that they have some practice about ethical reasoning that relates to their everyday decision-making. Now we are open to get the questions from the audience.
I have a question.
Yes.
Yes,
sir.
How long should the specimen be kept? And the current policy is if it's a homicide, forever. The reason is we are actually going to court. On the cases I did a lot of 1960, 1970, 40, 50 years ago, because of DNA identification is so sophisticated. Some of the specimens that I have actually removed the fluid or the portion of tissues that is large enough to actually do a very thorough DNA identification and solve many unsolved cases. As a result, preservations of tissues, specimens, and documents are absolutely necessary. That's a bioethical dilemma.
Of course, for forensic reasons, we can go back to, I don't know, murder that was committed 50 years ago, and if we have the specimens, great. Now what happens if the family of this person, or this person himself, believe that his soul will never rest before we put it to burial? Now, if I'm a scientist, I say, look, soul is a very nice concept. But, really the soul is just the way we explain to ourselves that our emotions and other things that are really based on biological, biomechanical occurrences in our mind. As I said, it's really nice that you believe that, but I believe something else. Now, are we going to go only by the scientific reason, or are we going to respect other ways of looking at it? And that's why I think it's really a dilemma, although professionally we all agree that it's the easiest and the simplest way to keep it forever or for a long time.
Yeah, I think we have a duty to inform the general public and different needs. We need the education among the professionals, and to perhaps like a certain reference book written how the standard bioethics is for the forensic pathologist, and we should get involved in the public education. Yes, please.
What's the most interesting or most difficult ethical dilemma you face in a case?
The most interesting ethical dilemma you face in a case?
I think it's the tissue procurement way before this organ transplant. It was 50 years ago. The growth hormones are only extracted from the pituitary glands of a deceased, and agency is serious. They want to get 10,000 pituitary glands collected so they extracted enough growth hormone so help the people. Mechanism they have done well. Autopsy technicians or whatever will give you $2 for each pituitary gland and so forth. Various medical centers actually cooperate. It's a great idea. The problem is that some technicians get $2, but the other people did not get, and so forth. The department intervened. Many people lost their job as a result of this. What began with a very innocent helping hand, not having guidelines, and pituitary was one of the things I can think of. All right, how about another question?
Yes. You dealt with media sometimes, Professor Noguchi?
Yes, some of you have seen it, Michael Jackson case, where the medical examiners are building. It's a 4-story building. It's surrounded by 500, 600 media people, maybe some observers, camera, like the thing international camera, about 100 different cameras, and expected Michael Jackson to remain be driven into to the facility. Well, it's strategy to meet him. We have arranged aerial service of the law enforcement. We airlifted remains and landed in remote areas so that we will not be harassed by news, and providing necessary information by public information officer. I believe people have the right to know, but they do not need to know everything. We need to have a guideline for what we release. We cannot release a written form by saying circumstances surrounding death, official cause of death, some toxicological information, enough to have this media taken care of information. We often give series of news conferences. Maybe strange, maybe, but I find that simultaneous release of sensitive information is the way to go. Our staff will never be permitted to give off-the-cuff interviews, and that will lead to disaster.
You did say that there should be a general list of things that should be released to the public, but what about the privacy of the family and the privacy of the person that passed away? Like, where do they interact in that?
Very good question. When it comes to sudden unexpected death, where it could be a murder or it could be a suicide or any other unknown reason, when it comes to official investigation, the agency has a duty to inform public. If you ever say we're not talking, then public will conceive there's something to hide. So that is, however, our work are generally defined by state law. We are very careful, but certain things, it's in conflict, but we must release.
So let me maybe interject in that. That's a very good question, and that's actually an ethical dilemma, the way I understand it. The fact that we may have some guidelines even in the law does not necessarily mean that we can agree on that law or that it cannot be changed or interpreted in different ways. Now, there are various players, if you put a game theory, in this specific scenario. So the investigation is primarily done, if it's related to the fear of a criminal offense, it's primarily done in order to see whether or not the person died because of a criminal offense. In some cases, it would be to see if there is maybe a very dangerous, contagious disease or something else of importance to the public, right? Now, the fact that you have the information means that you can first and foremost use it for the original reason, which was if there is a need to deliver it to the police or to the prosecution in order to, decide whether or not this is enough evidence, this is relevant or not to begin a criminal investigation or to go forward and maybe even press charges. That's one thing. That's the authorities, and usually they are bound by privacy and secrecy, and they're supposed to keep it to themselves. But that's one thing. The other thing is the family. Now, the way I see it, the family does not automatically have the right to receive all the information. It really depends on the scenario. That's why it's a big issue to discuss. This is like at least an article worth, if not a PhD worth kind of question, because there are so many different kinds of scenarios here. So let's say we have an information from an autopsy. Now, if some of the family members may have been or may be suspects, then perhaps at this point they're not going to receive the information before there is a formal decision to begin the criminal investigation, the criminal charges, and then they would have the information as a part of their defense. The same goes to, should we even have the forensic expert of the family there if we're afraid that it's also a part of the defense in the future. And if he is, we can find ways to allow him to be there, but also not to share the information and to put it in a safe. It should be a doctor until the court sessions begin. There are many ways to deal with that. So it's first the authorities, then the family, then of course the privacy of the person, which is the third question. The way I see it, it's the real big bioethical question. So there is privacy and there is the right to know, and I would assume that in general terms, the more it's a public figure, and I specifically talk about either politicians or decision makers that are relevant to our future, to our lives, and so on, then people perhaps need to know. Now, what happens if it's a private person who was killed, I don't know, in a marathon bombing? What do you do about that? Do we have the right to know exactly or not? Is some of our privacy kind of taken away from us where, in cases where we do not choose to be in the middle of something of public interest? I think that to some extent, yes. I think that this extent is to be discussed and should not be pre-decided as to always we should share with the public. Now, we can share some of the information. If a person died in the marathon attack, for instance, in Boston, and he also had a congenital disease or something, I don't know, why do we need to know all that? Is it really relevant for us to know about private matters? If a woman was, I don't know, she was pregnant, first months of her pregnancy, and she died in something of public interest. Maybe, I don't know, it wasn't from her husband. Maybe she was not married and she came from a society where being pregnant is not very well looked at if you're not married. Why do we need to share this information with the public where it's not directly linked to the public interest? So I think even if we are to share, we need to really be careful about what it is that we share with the public. Yeah, more questions, please.
So from a legal perspective, do you think that there can ever be one fair standard for cases? Like, can you formulate that one, like more clear-cut guidelines as opposed to having vague?
For what?
Very subjective for deciding how much information is to be released, in which cases you should keep the body in cars.
Okay, so I think that's a fair question. I think we have to look at the law as, I would say, the science of ethics. What do I mean by that? Ethics is basically dealing with the question, the way I see it, what is the right thing to do? And we use different methods to kind of make this decision. Now, the law tries to kind of take that one step forward and kind of be more specific about it and write rules and guidelines, so even more specific sometimes than the ethical codes, because I just told you that I see the ethical code as maybe a compass, like giving you the direction, not telling you exactly. Now, the law can be similar because it has its basic principles and values and constitutional rights and so on. I think without showing you specifically the laws either in Israel or in the US, you already have the framework to make those decisions. The framework in general relates to, you have the HIPAA laws, and you have to check to what extent the privacy laws that relate to people who are getting medical care actually apply in this case, if at all. You have other privacy-related laws. But what I'm saying is that we have the framework. I do not think it is even wise to try and find this one kind of formula that would always work. I can tell you in general terms that we can make a decision, for instance, then if it relates to a person who is a public figure, is an elected public figure, then the information could be delivered, or we could leave it for the discretion of the coroner or somebody like that. And I always think it's good to leave some room for discretion. We cannot really predefine everything. Once we do that, we find this different case where we're stuck with a law that doesn't really answer this specific case, and then we say that bad cases make us make bad law. It's not by me, I think it was Holmes who said that. So hard cases create bad law. And so this is a kind of a hard case, right? So I do not think we should establish that in a more specific way than it's established, but I do think we need to have the ethical framework. The way I see it, if we kind of create a discussion, an ethical discussion that doesn't presuppose that we know everything already, and because it's been done for 50 years or more, then now we're experts on everything. No, we are looking back at the same things that we did, and in this very kind of humble way, we tell ourselves, we are teaching ourselves to say we do not know, okay? We are telling ourselves we are ignorant. As Socrates told, the only thing I'm sure about is the fact that I'm ignorant. In a good way. I want to learn. I want to ask myself. I want to kind of doubt myself. And I do not want to accept what is done as this is done, and therefore this is the correct way to go. It's not about what we are doing already. It's about what we should do. And I think that's the basis for our discussion. So that was a long way of saying, no, I do not think there is one formula, but that's how lawyers do it.
You talked about the framework towards the end. You mentioned it. So what sort of framework would you use? Like ethics-based or principlism? I mean,
so basically, there are different ways to approach that, and we are still at the beginning of a few years of the way we see it, of constructing a framework for analysis. So we're basically beginning by cases and looking at the general values that are in place, and could we find this kind of general way to describe the values that are relevant in most of these cases. I don't think it's going to be the same always. For instance, we talk about human dignity. How do we look at dignity after death? Does it change a little bit? So these are the kind of things we're going to do. We can talk about rights as well, the rights-based discussion. So it could be, the right to privacy, as you said, the right to clear one's name, and so on. It's still work in progress. We are seriously thinking about taking the 4 principles of bioethics and that were developed here in Georgetown, to prominent expert in the Kennedy Institute of Ethics, right? So we're going to use that as a framework for analysis as well. And the one I like most, because I use it a lot, not just with doctors and healthcare providers, but also when I work with the Ministry of Education about ethics decision making, is a decision-making model that people can use in their everyday life as a way of asking themselves, am I going to act in an ethical way? It's not just a post-facto analysis, but it's like an online kind of analysis. And I'm not going to go into that in too much detail, but it's a model that was developed by some professors that are psychologists. They looked at many cases that went to the Israeli Psychologists Association and developed a model that contains warning signs. It begins by warning signs. Am I going to enter into some sort of an ethics problem? And if so, let's check what the problem is and can we avoid doing that.
This was another program on health, ethics, and law, an international educational initiative of the World Association for Medical Law. Scientific advisor, Professor Thomas Noguchi. Editing and broadcasting, Oren Asman. The program is available at www.thewaml.com.